We've heard from so many people who are missing what it was like to dine out before coronavirus. But now a video from Japan may have you rethinking the safety of some restaurants as they look to reopen. The experiment aims to show how easily germs and viruses can spread when just one person is infected. CNN's Anna Corin reports.
Common sight on cruise ships, resorts and casinos. Piles of hot food in communal trays, each patron helping themselves to as many servings as desired. If just one is infected, it may be the perfect setting for a virus to flourish. And a new video out of Japan helps show how fast it could spread. Medical experts teamed up with the country's public broadcaster, NHK, in an experiment that simulates a cruise ship's buffet-style restaurant. First, one of 10 participants rubs his palms with special liquid only visible under black light. He represents an infected person who had coughed into his hands. Then he joins 9 others as they spoon food onto their plates and sit down to eat. After 30 minutes, the room goes dark before an ultraviolet light comes on. The fluorescent liquid is now visible on a lot of surfaces. Items the so-called infected person had touched. Tongs, pitchers, food tray lids. Left residue others picked up. And in turn spread to silverware, dishes, glassware, clothing and phones. After half an hour, every participant had come into contact with the liquid. 3 of them had gotten it on their faces, a visual show of how easily a contaminated substance can travel.
The issues with that video is that there's a lot of material which was put on the hands, and so that's a very artificial situation. But I think what they've been able to do is to actually show just what the consequences are of the spreading of potential infectious disease from hands when proper hand hygiene is not performed.
Video of the experiment has been viewed millions of times since it was posted by NHK. The Joint Project Supervisor says it's partly meant to illustrate how often some surfaces are touched by many people, like handrails, light switches or door handles.
It may seem radical, but I think that video should be put in front of every single public restroom. Many of the countries which have opened up is that the outbreaks have been linked to small clusters, what people call not necessarily the people being super spreaders, but the locations being super spreaders, which highlights the need that people must be having much more attention to hand hygiene as well as to the social distancing.
NHK and its collaborators did a second, cleaner version of the experiment, using hygiene changes like separating dishes, replacing tongs frequently, and asking participants to wash their hands during and after the meal. 30 minutes into that experiment, no one had picked up the fluorescent paint. Anna Corin, CNN.
And this experiment comes as more than 100 health and science experts urge the nation's governors to require masks. In an open letter to all 50 governors, they say research shows that cloth masks can slow the spread. And with me now is one of the authors of this letter, Jeremy Howard. He is a distinguished research scientist at the University of San Francisco, and he led an international cross-disciplinary review of the scientific research on masks by 19 medical and scientific experts. And nearly all of the states, Jeremy, will be partially reopened this weekend. You just saw our report on restaurants and how quickly viruses can spread there. This is really the reason why you're pushing masks.
Yeah, that's right. It's not enough just to wash hands. Hand hygiene is important, but respiratory hygiene is also important. There's so many examples of cases of restaurants where people are passing the virus across to many other people in the restaurant just through speaking, talking to each other. The droplet clouds that are created can move all over the restaurant. I would be terrified of eating in a restaurant where there were people without wearing masks there.
And we've heard some new information that even someone who is speaking loudly can create virus in the air that lingers for 8 minutes. So that creates concerns about people being in an area that, and they may not even be there. You may walk right into really kind of what is a cloud of germs. And what do you need to combat that? What kind of mask?
Right. So that cloud of germs can spread out to 5 meters. This 6-foot social distancing isn't enough. But if you're wearing a mask, the research shows that that cloud does not go beyond a 1.5 meter boundary, so about 4 or 5 feet. So what people need to do is they need to cover their face. It doesn't matter too much what they cover their face with, a paper towel, a bandana, a scarf, or a sewn cloth mask. Pretty much anything does a great job of blocking the droplets on the way out. They're very hard to block on the way in because the science shows that they evaporate into much smaller nuclei. So we really have to hit them at the source. And remember, you don't know if you're sick. So everybody needs to wear a mask to keep their community safe and avoid a terrible second outbreak that could cause all these lockdowns to start again and for longer.
Let's talk about places where masks are important. What about if you're outside, you think you're pretty far away from people? I mean, you just described that the 6 feet is not sufficient, but if you're outside working out or you're near anyone who might be running by, you're walking through a park, should you be wearing a mask?
It depends how cautious you want to be. The research suggests that the transmission rate outside is about 20 times lower than inside. So this letter from the 100 world-class academic experts today specifically says we want to make sure that masks are required in all states in indoor places, in indoor public places, stores, transit, and so forth. When you're heading outside, it's really a case of how far away are you from people? Is there a breeze? How long are you standing next to somebody for? You just want to make sure you're not in a situation where somebody else is in your kind of droplet cloud for an extended period of time.
We also have some new video that I want to show to our viewers. This is the president. He's in Pennsylvania. He's at a distribution center, and I think he's the only one there who's not wearing a mask. He's inside. Is this proper behavior? I think I know the answer, but you're the expert. You tell me. Well, it can be said that the president is in almost a unique situation, that apparently he gets tested so often. But I will say, we really want to see leaders providing a great role model for everybody. And so to me, that means every leader, whether they be political or scientific, should always be shown wearing a mask when they're around others in public. Lead by example. All right, Jeremy Howard, thank you so much. We really appreciate this.